Why aren't we going to talk about the sacrum today? Anyone got a guess?
Axial.
Yeah, it's part of the axial skeleton. And we're not doing axial skeleton right now. We'll do this later when we talk about the axial skeleton. So we have the right and left coxal bones. And I could actually hold one up and say, is this a right or left coxal bone? One of the key features of the coxal bones is they contain the socket for the hip joint. Okay? And the socket for the hip joint is called the acetabulum. Okay? The two coxal bones join at the symphysis pubis, which is an amphiarthrotic joint connected by fibrocartilage. You can either call it the symphysis pubis or the pubic symphysis. And a definite anatomic, there are lots of anatomical landmarks on the pelvis that people use. They palpate for various kinds of injections and for radiographic positioning and that type of thing. Okay, so we'll talk about some of those.
Is that a male or a female pelvis?
It's a female because of the wider angle on the pubic arch. And here's a top view of male and female. You can see that they don't call it birth canal anymore. Well, you can, I mean it. But the pelvic outlet is the more uptown word. And you see the pelvic with a coccyx isn't quite in the way here like it is for the male. Okay, there are actually 3 bones that make up the coxal bones, and these bones fuse, they ossify together around the time of birth. They are, and they will become household words, I hope. The ilium, the largest one of the 3, the ischium, which is what we're all sitting on right now, and the pubis. And of course the pubis is the anterior bone that joins 2 coxal bones together at the symphysis pubis. In the female, the symphysis pubis spreads slightly at the time of birth in some folks. We have a real anatomical landmark here, the anterior superior iliac spine. And you can see this bone actually in a person with their swimming suit on or at the gym. It's these pair of anterior bones here that you can palpate and see visually. And so they're prominent anatomical landmarks. Here's the acetabulum. The 3 bones that form the coxal join at the acetabulum, right in the socket. A very deep socket, thus the hip joint is much more stable than the shoulder joint, but of course because of the depth of the socket, you don't have nearly the range of motion, nor in many cases do you really care unless you're a gymnast or a contortionist or something. We have the greater sciatic notch here and the ischial spine, and the ischial tuberosity is this reinforced part that we're sitting on. Okay? And those are just some of the features. We have the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine, none of which you can palpate. However, the posterior superior iliac spine attaches to the skin for some reason, and it's responsible for the little indentation that we see posteriorly, bilaterally, that are the little dimples that we all have. And that's where the posterior superior iliac spine attaches to the skin, interestingly. Okay, a very deep joint, and we see a ligament that attaches to the head of the femur with a little blood vessel running through here. A very difficult joint to dislocate, but the most common time it's dislocated is in a car accident when your knees get shoved. When you're sitting in the car and the engine comes and hits your knees and pushes your legs straight backwards, and it breaks the back out of the acetabulum and just shoves the whole femur backwards. Very nasty indeed. When you're reassembling that joint, great care must be taken that you don't cramp off this little blood vessel, because it supplies the blood for the head of the femur, and the head of the femur will die if you mess up. And so
what do they do about people that have total hip replacements?
total hip replacements, well, they cut it off here and take all this and throw it away, so they don't really care. Yeah, and then they put all of this that they put in is synthetic, and with the Teflon, the articular cartilage is replaced by Teflon. And it's connected to the lower leg right about there.
That part of the bone, it produces a lot of blood, doesn't it? So
It's really, you talk about blood cells?
yes.
No, not really. You'd think it would, Tom. But most of our blood cells are produced by the marrow that arises from intermembranous ossification. So the flat bones of the cranium, the ilium, and the ramus of the mandible.
So you don't miss the production of...
No, not really. But the ilium, that flat part of the ilium, is formed by intermembranous ossification, and that's a lot of red marrow. In fact, when they're typing your bone marrow type, that's where they take the marrow sample from, is the ilium. And what I understand is fairly painful to have done. So, okay, and so there is the ligament that holds the head of the femur into the acetabulum, and it arises from a depression called the fovea capitis, which will be a lab word of ours. Okay. This protuberance that sticks out laterally is called the greater trochanter, and you can palpate that too, right there. And it's an anatomical landmark. Okay. So you can put your thumb on your anterior superior iliac spine and your as-is, and reach down with your forefinger and palpate your greater trochanter. Okay, so just had all these pictures. Okay, so let's look at a little anatomy here of the femur, the largest bone in the body, posterior, and this is posterior, this is anterior. And we see the greater trochanter and the lesser trochanter, which is impossible to palpate because it's way down inside. On the posterior side, we have a prominent ridge that connects the two trochanters called the intertrochanteric crest. It's easily seen on even plastic bones. The one on the other side, the intertrochanteric line, can't be seen at all on plastic bones, but it connects the two trochanters. You can see it a little bit. It's a muscle attachment. You can see it on a real bone, which we don't have. The linea aspera, this sort of ridge down the posterior aspect of the femur. The fovea capitis, that little depression. And tucked up underneath the greater trochanter is the trochanteric fossa. You can stick your forefinger into that. Down at the bottom, of course, we have the articular condyles of the knee, the proximal articular condyles, and so this is the patellar articular surface that the kneecap articulates on. Okay, and we have the medial and lateral epicondyle, and right here at the top of the medial epicondyle is a little bump called the adductor tubercle, where you have a pair of adductor muscles that attach to that. Okay, and that's about all I can think of.
So the actual surface of the condyles is a condyle, and then on the outside is...
Oh yeah, then you always have epicondyles on the sides of condyles. Just like the two condyles of the elbow were the capitulum and trochlea, and we have the medial and lateral epicondyle, which were more prominent than these are. The patella is kind of an interesting bone, and you can actually tell a right or left patella. I'll tell you how to do it when we are actually sitting up there. It's kind of fun and easy. Okay, the muscles of the thigh are really cool and numerous. The thigh is a very muscular structure, and there's some really cool names. The most medial muscle of the inner thigh is the gracilis. Once you locate the gracilis, on either side of it, we have adductor muscles. The adductor longus is the longer, skinnier one, and the adductor magnus is actually posterior, can be seen posteriorly, and is the larger one. Okay? Sartorius extends from the as-is down to the medial epicondyle. Maybe you've heard the word sartorial. It means well-dressed. This is often called the tailor's muscle. I think because evidently tailors cross their legs a lot when they do their tailor stuff, whatever that is. And so you use this muscle to cross your legs, evidently. And we have tensor fasciae latae, which I just love because it has such a cool name. Sounds like a coffee drink. Yeah. Very cool name, kind of hard to spell. And it is an abductor, isn't it? On the lateral side. It goes from the as-is down to the lateral epicondyle. You see that the patella is completely surrounded by ligamentous connective tissue. This is called the quadriceps tendon up above, and this is called the patellar ligament down below. Okay. What else? On the inside of the ilium, we have the iliacus muscle, which is involved with posture, along with psoas major. And they support, bilaterally on both sides, they support the vertebral column and, keep us, or pretty much we're using them, even when we're sitting, we're using them to maintain upright posture. Okay. So, oh yes, and we have the quadriceps, which is actually 4 muscles. The most anterior muscle of the thigh is rectus femoris. Then we have the 3 vastus muscles, vastus lateralis, vastus medialis, and underneath rectus femoris, we have vastus intermedius. Okay, and these are some of the deeper muscles. The pectineus comes right off the symphysis pubis, and that'll be one of our muscles. And we have adductor longus and adductor magnus, and this one must be gracilis right here. Okay. So they're the muscles of the quadriceps. Okay. Posteriorly, we have the largest muscle in the body, the gluteus maximus. It is superficial to the gluteus medius, which is superficial to the gluteus minimus. But you can't see the gluteus minimus on any of our models, so I didn't put it on the lab. Probably should have. Can't even see it on this picture though. We have the hamstrings, and there are 3 of those. The lateral one is called biceps femoris, and medially we have one muscle deep and another muscle superficial on top of it. Semitendinosus, okay, is the one that's superficial, and semimembranosus is the deeper one. Okay. And that's about it, I think. Here we see, right at the symphysis pubis, we see, oh yeah, you take the gluteus maximus off, and we have piriformis connects the femur with the sacrum back here. It helps stabilize a lot of things. So, oh, there they actually show gluteus minimus, which is covered up by gluteus medius, which is covered up by gluteus maximus. And there's the netter picture, which is the most cluttered of all, that shows everything, but it's kind of hard to look at. More detail, just what we wanted, okay. The three ligaments are really easy. The ischiofemoral, the iliofemoral, and the pubofemoral, named for the three bones that make up the coxal bone. And they all connect to the femur, so they all have femoral at the end. Iliofemoral, ischiofemoral, and pubofemoral somewhere. But they show up really great on the skeleton. They're very obvious. Nothing ambiguous about them. Okay, so what do you think this is? Pubis. This is the obturator foramen, that great big hole. Can you guess what this is? Ischium. What's that stand for? Ischial tuberosity. Good. What's A stand for? Acetabulum. Head of the humerus. What's that? Greater trochanter. This is, what do you think that stands for? Intertrochanteric crest. Okay. And this is the ilium up here. That's kind of a good radiograph. Here we see a nice view of the head of the femur nestled into the acetabulum, and a perfect view of the fovea capitis. Greater trochanter, urinary bladder.
I have a question. Back on the previous slide, with the intertrochanteric crest, is that only on the posterior side?
That's on the posterior side.
So is
The
that
intertrochanteric line is on the anterior side, and it's hard to see.
So were we on a posterior view then?
What?
So were we on a posterior view then on the last slide?
Well, when we looked at the oh, that's a good question. Sometimes you can't tell. Hard to tell whether we're looking through. You see, the thing about radiographs is you're projecting through all these structures. And my guess would be that we're looking at an anterior view here. Yeah, I think we're looking at an anterior view, so we're actually looking clear through the femur to see that intertrochanteric crest on the back side.
Okay.
Yeah, good question. So here we see an axial view. What do you think that is? Of course, it says right there. Head of the femur in the acetabulum. Okay. Rectum, urinary bladder, sartorius muscle. I never asked that. That's really hard. I generally don't ask muscles off medical images.
Is this a CT?
What?
Is this a CT scan?
This right here probably is an MRI because the muscles show up really well. They tend not to in CT. Plus you can distinguish between bone marrow and non-bone marrow. My guess, it almost certainly is an MRI. Symphysis pubis, greater trochanter, acetabulum. This is the anterior superior iliac spine right there, the as-is. What do you think that stands for?
Sacroiliac.
Sacroiliac joint, the joint between the sacrum and the ilium. And you see the muscles show up really nicely. You can see that the gluteus maximus attaches most medially, and the gluteus medius attaches more laterally, and the gluteus minimus attaches even more laterally. And it looks like the urinary bladder is about half full. So what's that, do you think? Of course it says symphysis pubis. So this is inferior to the other view, isn't it? Can you see that? That's considerably superior, and these are kind of mixed up actually. That one's really superior. And then we jump down to most inferior, and that's the ischial tuberosity, which we're sitting on, and that's a symphysis pubis. Okay. ischial tuberosity, this is the inferior ramus. A ramus is a long, flat part of a bone. It's a word we'll run into. Lots of bones have rami. And this is the inferior ramus of the pubis as it connects to the ischial tuberosity. And those are good. So let's get up there and